Hi, I'm Ryan.
My name is Emeka. I'm a senior student nurse at MCPHS University's Manchester campus, class of 2014.
And we're here today to talk to you about the grave issue of medication non-adherence in psychiatric nursing, as well as discuss some of the evidence-based techniques that can be used to reduce medication non-adherence in these patient populations. But before we understand the problem, let us first define it. Adherence, for the point of this presentation, can be defined as the degree to which the patient follows the lifestyle changes and medication regimen prescribed to them by their healthcare provider. There are a variety of detrimental complications that can be attributed to medication non-adherence in psychiatric nursing. One of those is symptom relapse. A study done by Katon in 2001 found that 60% of patients taking antidepressants discontinued them before their 6-month therapeutic regimen was up. This resulted in an increase in symptoms of suicidal ideation. In fact, another study done by Herings and Erkens found that these patients were 4.2 times more likely to attempt to commit suicide because of medication non-adherence. And finally, in another study done in 2010 by Patel, they found that 50% of schizophrenic patients were somewhat, if not completely, non-adherent when it came to taking their antipsychotic medications. This resulted in an increase in exacerbations of their disease of psychosis, where you get visual, auditory, even olfactory hallucinations. And this is where it begins to affect society as a whole. When you have patients like schizophrenics that refuse to take their antipsychotic medications for whatever reason, and they have those exacerbations, they become a danger to themselves and to others, and they need to be readmitted to the hospital. When you go through that whole process of being admitted to the ER, getting assessed, and then waiting up to weeks to be admitted to a psych ward, this is costing the healthcare system millions upon millions of dollars each year. Now, you might ask, so why are patients not adherent in the first place? Well, one of the answers to that question is the side effects of the medications themselves. For the generation 1 typical antipsychotics, you get extrapyramidal effects, which is you could have pseudo-Parkinsonianism, where you might have akathisia, which can be sometimes manifest like a pill rolling that's involuntary movement, where they take their thumb and their index finger and they sort of move them together like they're rolling a pill. But you can also get something a little more severe known as tardive dyskinesia, which is irreversible. And it's basically the same kind of thing. It's involuntary movements, but it's all over the body. It could be the arm. It could be involuntary movements where they just keep stepping backward and forth with their feet. It can involve the face as well. It can involve a number of different parts of the body when it comes to involuntary movement. Now, as a result of this, they came out with generation 2 antipsychotics, or atypical antipsychotics. And with those, they decreased the extrapyramidal side effects, but the result was it was an increase in another side effect of weight gain. And now you have patients that are more at risk to develop diabetes type 2. None of these symptoms are very appealing, and you can understand why these kinds of patients would want to be non-adherent when it comes to taking their medications in the first place. Emeka is now going to talk about several evidence-based techniques which have been proven to decrease medication non-adherence in these patient populations.
All right. Before I delve into these techniques, I would like to say that there is no one single silver bullet, no end-all strategy to solving the problem of medication non-adherence. A meta-analysis of the literature reveals that the most effective strategies to combat medication non-adherence in psychiatric nursing is a combination of different interventions. It's a combination of pharmacological interventions like the use of long-acting injectables and oral disintegrating tablets, commonly called ODTs. The use of cognitive behavioral therapy like motivational interviewing. And lastly, the use of effective educational interventions like telenursing interventions, problem solving, also called TIPS. Now, I'll be speaking at length about these 3 different strategies, and again, reinforcing that the best possible way to improve adherence in your patients is the combination of these factors. The first one, pharmacological, probably the easiest one, because all you really do is give a medication like, say, long-acting risperidone or long-acting Invega injections, usually given intramuscularly once a month, and that's it. You know, a patient gets it once a month, and they're pretty much adherent for that whole month until the next scheduled injection. ODTs, which are orally disintegrating tablets, you take them one time and they dissolve into the mucosa. It's like a regular oral medication, but the difference and the advantage is you don't have patients chicken medications, because a lot of times you find that psychiatric patients chick their medications. You know, they chick them and they dispose of them later on or use them for other things. Those are probably the easiest of the interventions. At the same time, they're not realistic for everybody. Long-acting injectables, orally disintegrating tablets are very expensive medications. Not every insurance would allow it. Not everybody can afford them. So we have to think about other strategies that we could use, again, like I said, in synergy. Brings me to the second one, cognitive behavioral therapy, like motivational interviewing. I've used this in practice before. I've used it and I have received good results from using it. Motivational interviewing is a form of psychotherapeutic intervention which helps you as a clinician to identify, it helps you in collaboration with your patients to identify present and potential problems. I find that some psychiatric patients do not believe they do have a form of psychopathology. They feel it's, you know, an evolution. You know, maybe they feel that they're not manic. You know, they have these delusions of grandeur. They feel like it's a skill from God, even that they're, you know, they think they think they're invincible, if I should say. As clinicians, we should explore the attitudes of our patients to psychology. We need to try to find out what the problem is. Do they really believe they have a disease? And if not, then how can you help them identify that they do have a problem? How can you help them identify the positive symptoms, the negative symptoms of their psychopathology to help them see why they need these medications, like the you know, lithium for, should I say, for your bipolar, for manic, the first, second generation antipsychotics that I spoke about a little bit earlier. If you help your patients find that they do have a problem and they need these medications, the benefits of using these medications, then they are more likely to be adherent to their medications. The third strategy was the TIPS, Telenursing Interventions Problem Solving. This is a form of, should I say, it's more communication. You as a clinician, you as a provider, you proactively reach out to your patients after discharge to find out if they have any problems. Sometimes patients leave the hospital on a prescription of, say, a second generation antipsychotic, like olanzapine, risperidone, paliperidone. These are very expensive medications. They cannot always afford to refill these prescriptions. Sometimes they just stop taking them. When you reach out to them proactively to find out what the problem is, it's a form of clinician monitoring. You find out if they have financial problems or if they just have problems with side effects. Now, if they do have financial problems, you could use a form of case management as a provider, as a clinician, to link them up with, say, another healthcare provider that may prescribe them a first-generation antipsychotic, which is more affordable, and then proactively prescribe them a form of, say, an anticholinergic medication that will help those side effects that Ryan spoke about they get from the first-generation antipsychotics. You prescribe them something like Congentin, or say Atane, or Benadryl. That usually helps with some of the, you know, extrapyramidal symptoms, like akathisia or some of the other dystonic movements. Yeah, now and again, those three, like I said, in conjunction will or should increase the chances of your patients being more adherent to their medications. As nurses, as future nurses, as clinicians, as providers, you should keep in mind that psychiatric patients are omnipresent across the healthcare continuum. You don't just have them in psychiatric hospitals. You also have them in medical surgical units. You have them, you can find them in the ICU, you can find them in the OR, we should always try to put ourselves in a position where we can help these patients find out if they're adherent to their medications, and if not, how can you help them increase their adherence to their medications.